Benign Paroxysmal Positional Vertigo, otherwise known as BPPV, is a non-life-threatening medical condition that causes very brief episodes of vertigo or room-spinning sensation, lasting for a few seconds, typically triggered by specific sudden head movements. How common is benign paroxysmal positional vertigo? BPPV is one of the most common causes of dizziness, and it affects about 30% of people with vertigo. This condition is more common in the elderly, typically between 50 to 70 years old. However, in younger persons it usually occurs following head trauma such as a concussion. What causes benign paroxysmal positional vertigo? To properly understand the cause of this condition, we need to first look at the overall structure and function of the ear. The ear performs two major functions as follows. It assists in hearing and also in maintaining balance. This makes up the auditory system and the vestibular system, respectively. These two functions of the ear are controlled by an important structure called the vestibulocochlear nerve. The vestibulocochlear nerve is made up of two branches, the cochlear branch and the vestibular branch, which control hearing and balance, respectively. The vestibular system consists of three main structures called the semicircular canal, the utricles, and the saccules. The semicircular canals consist of fluid-filled, tube-like structures lined with hair-like receptors. These hair-like receptors sway in various directions in response to specific rotational body movements. This swaying motion of the receptors in turn transmits precise positional sensory signals to the brain to help maintain balance. On the other hand, the utricles and saccules consist of fluid-filled tube-like structures lined with hair-like receptors coated with tiny floating calcium carbonate crystals. The orientation and position of these calcium carbonate crystals at any moment in time is solely dependent on the direction of force of gravity. As such, the utricles and saccules are crucial in detecting and responding to positional changes of the head and body in relation to gravity to help maintain balance. So what happens during BPPV? Well, the calcium carbonate crystals located in the utricle and sacculae become dislodged, i.e., due to trauma or inflammation of the ear canal. Once these crystals get dislodged, they randomly float around from the utricle and saccules and into the semicircular canals. When this occurs, it leads to a sense or feeling of imbalance which presents as vertigo or dizziness. Of note, about 50% of cases of benign paroxysmal positional vertigo occur without any known cause. This is known as primary BPPV, while those caused by known causes such as trauma or inflammation of the ear canal are known as secondary BPPV. So what can increase your risk for having benign paroxysmal positional vertigo? Sustaining a head trauma, an ear canal infection, having migraine headaches, or even a stroke can increase your chances of developing this condition. What are the symptoms of benign paroxysmal positional vertigo? Patients may experience a room-spinning sensation, whereby they feel like their surroundings are rapidly spinning around. This sensation typically can occur multiple times a day, lasting for a few seconds, and triggered by a quick head turn in a certain direction or by suddenly looking up. During these episodes, patients may also complain of mild nausea and vomiting. So how do we diagnose BPPV? The diagnosis is based on clinical findings, such as description of the symptoms experienced by the patient, the triggers, and the findings on physical examination. A provocative physical maneuver called the Dixie-Hallpike maneuver, used to trigger these room-spinning sensations, is quite helpful in confirming the diagnosis of the condition. How is BPPV treated? The best treatment strategy requires a multifaceted approach of properly educating and counseling the patient on how to lower risk of recurrence and providing current symptom relief. One such useful tool for symptom relief is called the Epley's maneuver. This is a corrective physical maneuver used to reposition the dislodged calcium carbonate crystals floating in the semicircular canal back into the utricles and saccules. In most cases, the Epley's maneuver is effective in controlling and treating the condition. In fact, about 30% of individuals have their symptoms resolved by 3 to 4 weeks following the Epley's maneuver. However, in majority of cases, the symptoms completely resolve in a couple months. It is also worth noting that about 1% of patients may have their symptoms persist, despite the Epley's maneuver. In severe cases, surgical treatment may be an option. Here are a few questions you may ask your doctor about benign paroxysmal positional vertigo. What is the cause of my symptoms? Can I pass on this condition to my children? What are my treatment options, and are they effective in completely eliminating my symptoms of vertigo? Can a stroke cause similar symptoms to BPPV, and if so, how can I tell the difference? What should I do if I think my symptoms are due to a stroke? Here are the take-home points for benign paroxysmal positional vertigo. Firstly, it is caused when calcium crystals in the ear get dislodged. Secondly, it can be caused by trauma, ear canal inflammation, or in some cases occur without a known cause. Thirdly, individuals may experience a room-spinning sensation, vertigo, lasting for a few seconds, usually triggered by certain head movements. Fourthly, the Dixie-Hall-Pike maneuver is a physical maneuver which can be used to diagnose the condition. Finally, BPPV can be treated using a corrective head maneuver called Epley's maneuver, designed to reposition the dislodged calcium carbonate crystals in the ear. Ready to try a few practice quiz questions on this topic to test your understanding? Question 1. What is benign paroxysmal positional vertigo? A. A cause of brief episodes of room-spinning sensation triggered by specific head movements. B. It is a severe type of stroke that causes dizziness. C. It is a mild flu episode that lasts for a brief moment. D. A mild stroke that occurs in specific areas of the brain. E. A type of hearing loss. The answer is A. Question 2. What are some triggers for benign paroxysmal positional vertigo? A. Blinking too much. B. Drinking too much water. C. Coughing too hard. D. Taking too much pain pills. E. Sudden turn of the head in a certain direction. The answer is E. Question 3. Which of the following tests is used to diagnose benign paroxysmal positional vertigo? A. The straight leg raise test. E. The dilated eye exam. C. The Dixie-Hall-Pike maneuver. D. The blood sugar level. E. MRI imaging of the brain. The answer is C. Question 4. Which of the following is used in managing benign paroxysmal positional vertigo? A. Brain surgery. B. Steroid injection to the neck. C. Taking Zoloft for depression. D. Epley's maneuver. E. Heart surgery. The answer is D. Question 5. What are some symptoms of benign paroxysmal positional vertigo? A. Severe thirst for water. B. Room spinning sensation lasting for a few seconds. C. Severe eye swelling and redness. D. Passing out for a few minutes. E. Seeing spots when you look at the TV. The answer is B. Thank you for taking the time to learn with us today. We trust that the information presented was of help to you. If you found this information helpful, click the like and subscribe button for more. Until next time.